welcome to ASAP Conversations. This is a new series, and we're going to invite guests to uh, have conversations with us around the current situation, the pandemic, and especially in relation to the communities that we work with and how it has affected the people, especially in relation to abortion rights and larger SRHR access. And today our guest is Dr. Manisha Gupte, and welcome, Dr. Manisha. And I will ask you to introduce yourself a bit and tell us a bit about yourself and your work.
Okay, so I'm Manisha Gupte, and I've been part of the Indian feminist movement since the mid 1970s. And in 1987, after living in a rural drought-prone area for 5 years, I co-founded Mahila Sarvanti Utkarsh Mandal, which is MASO. It's a rural feminist organization, and we work on very intersectional approaches because it's a community-based organization. We also do capacity building. And my association with the Asia Safe Abortion Partnership is long drawn, and I've been associated with it since the first YI Youth Advocacy Institute that was held in Bombay. And so I'm very happy, Nandini. Thank you. I'm very honored that you and Sujita and Aisha thought I should be on this conversation. So thank you, and thank you to everybody who's listening on.
Yes. Thank you for everybody who tuned in today. The communities that you worked with, like you mentioned, rural communities, you mentioned using intersectional feminist approaches. So in your experience, in your, all these years of engagement, if you can share a bit about, the kind of issues and challenges that these communities, these people were already facing, women were already facing. And because I think there is an important need to also remember the situation before COVID-19, because there is this whole discourse that's shifting now entirely to look at COVID-19 as if it is bringing out new issues. But we already, as you will know better, that there were already so many challenges that we were facing. So if you can tell us a bit about that, the situation that you were dealing with before the pandemic.
So let's first realize that what existed before the pandemic was not all great. There were structural violences which exist right now. The biggest structural violence is, of course, our patriarchy, it's class, it's heteronormativity, it's caste, it's able-bodyism, it's majority versus minority politics, cultural nationalism, rise of fascism all over, neoliberal globalization. So all these existed even prior. Now what happens is that any tragedy, whether natural or human-made, affects different people differently. And it affects in a very gendered way. And so therefore, when we come to the pandemic, that's what I'll highlight at that point. But even prior to the pandemic, we found, and I'm very specifically going to focus on access to safe abortion in this conversation. So what was the pathway that women chose or had to choose or had no choice when they got pregnant? First of all, did they even want to get pregnant in the first place? That was the question at that point of time. Okay. Second is, how does the state view their pregnancy? How does the state view a pregnancy that is the third child after marriage? When it takes away your political rights, when it takes away your economic rights, how does society see a pregnancy that's outside of marriage? How does a trans man, somebody who's a woman but feels like a man, gets pregnant? What does he do with his body thereafter? So all these questions do exist, and then what do you do with that pregnancy? So the pregnancy, and when you don't want the pregnancy, the state sees the Medical Termination of Pregnancies Act, or if we are dealing with India, it's provider controlled. The provider decides whether you can or whether you cannot. Legally, there's limitation, and it's fetus centered. So what is the condition of the fetus? And it's technology centered. So did contraception fail? Except the fact of grave mental or physical harm, there is really nothing that is woman-centered. So why does a woman have to prove that the pregnancy happened because of ABC? Why does she have to prove that she does not want the pregnancy to continue? Why can't it just be simply woman-centered? And it never was, and it won't be through the pandemic. And hopefully, let's hope after the pandemic, with all our advocacy, it will become. So what happens is that once somebody realizes they're pregnant, uh, the entire pathway to reach a safe abortion service sometimes can take 2 months, can take 3 months. First of all, you don't know, you're not very sure. There's everything that you're dealing in your mind, whether you continue the pregnancy or not. A study that we did when I was a researcher with Sehat, 1994 to 97, with two other colleagues. Women said, I chose to have the abortion. The decision was mine. But actually, when you really went to see, the decision was anything but hers. A mother-in-law wanting to look after her daughter because she was coming back for childbirth, or husband losing his job. So many things, but nothing to do with. I'm not saying the woman just decides and says, "Oh, today let me go and have an abortion." I mean, it's not such an easy decision. She reaches that after back and forth, and a lot more back than forth. And therefore, what we expect from the state is to help us with the forth, to help us to go ahead and not hassle the woman when she goes for the abortion. So even before the pandemic, what you found was that it was the boyfriend or the husband who was getting the condoms, because premeditated sex for a girl, for a woman, is even worse than actually having sex. That I'm going to have sex and therefore I need condoms at home is really makes her not such a good woman, especially in rural areas. So who gets the condom? The men get the condom. Medical abortion pills not available. Emergency contraception, the man gets the pills. Who takes her to the abortion service? Somebody else. You want to go as far as possible because you don't want confidentiality to be breached. This was the condition before the pandemic. And obviously, as we know, it has would be exacerbated in this COVID-19 pandemic, isn't it?
Thanks, Manisha. I think that brings out a lot of, I think the truth about the system and the systemic gaps that exist, and that you mentioned about how this, what the state's role should be. It's a question that I sort of want to follow up before I go to the next one. Is I know that you and other activists are also working on this whole issue of abortion as an essential right during the COVID-19, because as elective surgeries and as hospital are being suspended, hospitals are being emptied to sort of ready for the pandemic when it surges. So in that context, can you tell us a bit about what is the situation currently right now in India in terms of, is abortion an essential service? Are women able to go for it? Are access abortion rights? Also, because given that we are seeing on it's being televised and it's being celebrated by, many, the kind of authoritarianism that we are seeing. So there are like now two kinds of sort of obstacles for women. One is that probably a unconducive family environment, or even trans men. Anybody who needs abortion right now will probably not have support at home, most likely, and they will also not have support once they step out, because obviously these are issues that they can't openly talk about, and the system is so insensitive, and the policing we are seeing is unprecedented, I think, even for our country. So if you can tell us a bit about that, abortion as an essential right, like, is it something
Mhm.
that we see? Yeah.
Just very, very recently, the Minister of Family and MOHFW said that abortion should be considered, and that probably is because many of us, include ASAP, all of us, Masuk, all of us are involved in advocacy, Pratigya campaign, many common health, etc. Because of the MTB Amendment Bill 2020. But that still hasn't reached, and we don't know whether it will. So now let me backtrack a little bit. So all access, including health access, medical access, within that sexual and reproductive rights, and including safe abortion. All these have been drastically affected because of the lockdown. Uh, Private hospitals have just given up. Most private hospitals have just shut down. Public hospitals, which actually have stood up at this point, imagine with all the privatization that's taking place, it's the public hospitals at this point that are any kind of panacea to people who require healthcare. I think this is something that we should all remember, that public health services, government health services need to be strengthened in our country. But the OPDs, the outpatient departments have been shut down. And abortion is considered an OPD procedure unless, of course, it's a big hospital, a civil hospital, where rightly they get the woman to get admitted the earlier night so they can have the ECT, etc. So what we are saying is that this should become an essential service for simple reasons that there are legal implications, right? And in lockdown, imagine the effort that I have to make now to reach a health service. The barriers always existed. But now imagine in lockdown what happens, and then to be sent back, and then to go beyond the legal age, the limit for abortion. So all these have now become exacerbated. Women, we've seen a spike in domestic violence throughout the world. In fact, the UN Secretary General exhorted all governments to treat responses to domestic violence, whether they are legal, whether they are counseling, whether whatever services, medical services, as emergency essential services. Now, all people who are being battered, women, children, 94,000 calls to the child helpline in India in 11 days after lockdown started. So you can imagine, we've blown the myth that we always said that the home was actually the most unsafe place for women and children. And that is what this pandemic has proven, that it's not stranger danger, but it's the people that you know and the people that you trust who are actually forcing you to have sex. So, and also bad. So now women and children are now cloistered within the home with their batterers and with their abusers, both physical and sexual. Can you imagine this kind of news because of family honor leaving out? Can any neighbor or can anybody reach out to the women or children who are undergoing sexual violence or even sexual activity, which might increase because people are now forced to not leave their neighborhoods? But sex, whether it is forced or whether it's consensual, again has gender impact, doesn't it? So now, from where are the condoms going to come? Especially if the sex is not premeditated. What happens to the pregnancy thereafter? Even before the pandemic, Masoom conducted a study in 7 states, and we found out that discrimination is rife. The providers have their own sense about who deserves to have an abortion or not deserves to have an abortion, and who deserves to become a mother and not deserves to be a mother. So sex workers, people who are living with HIV are not considered mothers, and therefore then they could have an abortion. But that's with extreme hostility, with extreme stigma. And the others who don't want to have the pregnancy are in that sense irresponsible. Why did you get pregnant in the first place? So there's violence prior, there's violence through, whether it's abortion or delivery, you weren't screaming when it went inside. Why are you screaming when it comes outside? So all these things we have seen overstayed. So everybody faces stigma and discrimination, and also there's a lot of guilt and a lot of shame, which then gets magnified when you don't have access to any other services. So if a woman leaves the village now to go to a health service, first of all, the stigma will be, does she have COVID-19? And no family wants to face the stigma of anybody thinking that somebody has corona, the virus, because that will immediately isolate them from. Imagine if doctors are being stigmatized. People are not getting into elevators when there's a doctor in the same building. You want to go to the health service and see a doctor, and then when the doctor comes back home, these fancy gated communities stigmatize the doctors. So you can imagine somebody who's actually seeking the service. So within this pandemic, we are actually, I would say, in not in a cynical way, but I would say that actually the pandemic has shown us the underside of what our society always was. And that's why if we are wise enough we will realize that this is what happens. You stigmatize a particular religion, you demonize some people, you think that othering somebody will be easier. As Irving Goffman says, that if there is stigma for one, there will be stigma for something else. And because we have stigma for caste, we have stigma that is gendered, whether it's menstruation, sit outside, etc. It will also come for those who have the corona virus. So rather than realize that those who are actually in hospital or those who are staying at home are helping us along with helping themselves. And actually that's why I am not going to get COVID-19 because somebody is now quarantined or is in hospital. Rather than that, there's just more othering. And so pregnant women who are not going to be able to access abortion during this lockdown, which obviously is going to increase, at least in certain zones in India, where you find that a lot of asymptomatic people are passing on the virus to other people. What are these women going to do once they go beyond the legal limit of abortion? Imagine the number of unwanted pregnancies and the unwanted deliveries that are going to take place next year. Imagine the burden and the stigma and the shame of all the women who didn't want to carry these pregnancies to term. Having all those, or even those who are married or who are stable. Imagine what's going to happen when people are going to get laid off, women having to look after children rather than pursue their careers or look for other jobs. So this is what it is. So I don't want to be like a I don't want to be somebody who's bringing bad news. I'm just saying it's out there. And let's look at it seriously, and if possible let's look at it in a way that uh, can we mend some of the ways that existed before the pandemic that actually this virus brought to light.
I think you've said that really well. Like, the pandemic is revealing what was already there. So none of these problems or challenges that we are facing today because of the pandemic are new. Most of it is, like, except for the virus itself, everything else is old. So I think that is a very important takeaway for many of us, because the mainstream media is kind of missing out, I think, that point. And when they look at the pandemic, they are going after a certain community. They are increasing the stigma around certain people, races, and all of that. And I think that is taking away the focus from the real issue. And the real issue is the systemic gaps that was anyway already there. So thank you so much. I mean, if there is anything that you want to add, because to this situation, to the current situation, and something that maybe receiving or hearing from women that you work with, if there are any sort of first-hand situations that you faced that you feel is important to highlight, you can, and we could sort of.
So what I'd like to say is that every crisis has an opportunity.
Mm.
uh, and in those opportunities, as I first said, that make abortion services women centered. That's the first thing. Let's strengthen our public health services. Let's realize that we don't need so much, that nature doesn't really need the human race. The human race is locked up. You find peacocks on the streets of Bombay. You find whales and dolphins coming close to Bombay. You find the birds in my city, Pune, that you have never seen before coming out. Yes, so actually, nature, doesn't need us. We need nature, and I think if we can realize that. The third is that if we can um, realize that violence or stigmatizing doesn't work, that we don't need things, that we need people around us. If we human beings realize that, and if we can move towards a more sustainable world, a more equitable world, then that would be really good. And if we can advocate for strengthening of our services, and to see that nobody is discriminated, nobody is denied any kind of health service, and that the uh, entire campaign in India that's going on for universal access to comprehensive health care, becomes a reality, because it's only when we have comprehensive healthcare that you can have sexual and reproductive health. And only when you have sexual and reproductive health can you have abortion services. And without those rights, SRHR, don't mean anything unless we call state responsibility and state obligation to provide these health services. So I think these are some of the opportunities, and for men to realize that working at home, helping out is not actually helping out, because it's their share of housework. So they're actually now sharing housework, and maybe they might actually find that looking after children or doing housework is not such a bad thing. It's actually quite interesting. And then the last thing I'd like to say is that to never forget the intersectional approach. That in situations of uncertainty, child marriage, early marriage become the norm. Trafficking of people, especially women and children, become the norm. And so therefore, the earlier we get out of the uncertain situation, the better. And women's health or women's rights can be secure only when the rights of the community or the entire country and the world are safe. And so therefore, in my community, where migrant workers don't have food, where you see almost concentration camp like skeleton, the photos that are coming, you can't even look, not my community, but other places, you can't even look at those photos. How can anyone's rights, including women's rights or children's rights or abortion rights, be safe? So I think this pandemic has given us one more chance. We can go to the brink of disaster, or we can come back. We can be grateful to nature, and we can think of how to reorganize the order that is based on equality and democracy.
Hmm. Thank you so much, Manisha. I think this is sort of the way we wanted to end the conversations also. And for our audiences, the takeaway is definitely that from, speaking from a rights and from a public health perspective, violence and stigma doesn't work, just as Manisha said. And therefore, the approach has to be people-centric. The approach has to be environmentally sustainable. The nature doesn't need us, absolutely. And same in the same way, intersectional approaches, because like for us also, when we work on gender, we work on sexuality rights, but so much of it is like the right now in the country is the glaring condition of the migrants, glaring conditions of laborers and daily wage earners, and we don't even know what is the situation there. We are hearing hunger deaths, we are hearing suicide rates are going up, and I hope that we together with the communities that we work with as activists, we can all come together somehow and hold our governments accountable to sort of help build that world that is a better world, a just world. Thank you so much, Dr. Manisha. And if there is any last comments or anything, and we can, I think it was great talking to you today. So thank you so much for sharing all these
Never to
points.
give up, never to give up the hope that a better world is possible. And like Gandhi said, be the change that you want to see. So let's start in our small and big ways. And that collectives can do much more than all of us can do individually. So let's collectivize all over again. Through peaceful means, let us make the world a better place. Never to become cynical, and never to give up hope.